Welcome back to Module 1, Introduction to Abnormal Psychology. This is Lecture 4, and we will be talking about the psychodynamic model of abnormal psychology. Last lecture, we talked about the biological model, which centers psychological abnormality in the malfunctioning of the brain. The biological model is supported by a great deal of research demonstrating connections between psychological disorders and problems in the brain. The psychodynamic model is very different from the biological model in that it is largely theoretical, with little or no basis in scientific research. Now, this is not necessarily a reason for us to dismiss it as invalid. The field of abnormal psychology has benefited in many ways from psychodynamic theory. As stressed in Lecture 1 of this module, we're dealing with complicated stuff. However, it is nonetheless important to bear in mind as we talk about psychodynamic theory that, unlike the biological model, there isn't much science behind it. So what is psychodynamic theory? Psychodynamic theory is the oldest and possibly the most famous of all the models of psychological abnormality. While there are many different versions of psychodynamic theory, this model got its start in the early 1900s with a Viennese neurologist named Sigmund Freud, whose name you may already know. Dr. Freud developed the original psychodynamic theory. He named it psychoanalytic theory. Psychoanalytic theory proposed an explanation for both normal and abnormal psychological development and functioning. He also created a very specific method for treating people who struggled with psychological disorders that was based upon his theory. He named this form of treatment psychoanalysis, and the doctor who carried out the treatment, the psychoanalyst. Freud had many colleagues who initially accepted and utilized psychoanalytic theory and psychoanalytic treatment, but then went on to develop and use their own versions of the theory, each one a little bit different from Freud's classical theory. Two of the most famous people who split from Freud to pursue their own versions of the theory were Alfred Adler and Carl Jung. As time went on, right up until the current time, many different versions of psychoanalytic theory have developed. Taken as a group, they're referred to as psychodynamic theories. All these theories can trace their development to Sigmund Freud's original theory, and all of them seek to provide explanations for both normal and abnormal psychological development and functioning. So what do all of these psychodynamic theories have in common? There are several fundamental features common to all psychodynamic theories. All of the theories assert that our personalities, thoughts, feelings, and behaviors as adults are rooted in early childhood. Following from this, all psychological abnormality originates in early childhood experiences. Relationships, particularly the relationships people have with their caregivers in infancy and early childhood, are critically important in shaping adult personality and psychological functioning. Adults are not consciously aware of the early childhood experiences and caregiver relationships that have had such a profound impact on their personality and psychological functioning. Psychodynamic theorists refer to this as the unconscious mind. In particular, people who are struggling with psychological abnormality are not aware of the early childhood origins of their struggles. How do psychodynamic theorists approach treatment for psychological disorders? While the biological model seeks medical forms of treatment for psychological abnormality, the psychodynamic model utilizes an approach that is predicated upon relationships, which is not surprising since early relationships are where they situate the origins of the problems in the first place. Specifically, the model uses a conversational approach to treatment called psychotherapy, or simply therapy. In Freud's time, the therapy was called psychoanalysis, and it consisted of the patient saying whatever came into his or her mind in a stream of consciousness manner known as free association. The psychoanalyst never said anything at all. Instead, the analyst silently listened to the free flow of the patient's speech. The theory stated that if the patient talked long enough, the unconscious material involving the early childhood origins of their problems would eventually surface. It was the analyst's job to listen for the unconscious material in the patient's free associations and interpret the early childhood origins of their problems. The analyst then shared their interpretation with the patient. In this way, the patient's unconscious mind would be brought into their conscious mind. Psychoanalytic theory stated that once unconscious material was made conscious, the patient would be cured of their psychological abnormality. Modern psychodynamic psychotherapy looks very different. It consists of a back-and-forth conversation between the patient and the psychotherapist that allows the development of a relationship between the two people. Similar to Freud's psychoanalysis, however, the modern psychodynamic therapist continues to look for the early childhood origins of adult psychological abnormality and believes that the adult's early relationships with primary caregivers are extremely important in determining adult personality and psychological functioning. There are other similarities between modern psychodynamic therapy and classical psychoanalysis. Modern therapists also believe that once their patients understand the early childhood origins of their problems, they will then be able to solve them. Modern therapists may use classical techniques such as interpretation of free association, dreams, and resistance, as well as the patient's transference to the therapist. Let's take a moment to consider the techniques we haven't discussed yet. Freud called dreams the royal road to the unconscious. He believed our dreams are rich with the early childhood origins of our problems, and that it is the analyst's job to interpret dream material and provide the interpretation to the patient. Many modern psychodynamic therapists continue to interpret their patients' dreams, a process known as dream work, in order to help them discover the early childhood basis of their problems. Resistance refers to a patient's refusal to participate or engage in a particular topic of conversation with the therapist. Modern psychodynamic therapists believe this resistance provides a clue to the early childhood source of the patient's struggles. Finally, transference refers to the way in which the patient relates to the psychotherapist. Psychodynamic therapists believe that therapy patients will treat their therapists as if they are particular significant people from their early lives. By identifying and interpreting the way their patients relate to them, therapists believe they can uncover the early source of the patient's problems. As I'm sure you can see by this point, the psychodynamic model is difficult, if not impossible, to research. While serotonin is an identifiable neurotransmitter in the brain, and it's possible to compare the levels of serotonin present in the brains of depressed versus non-depressed people, how would scientists go about testing the connection between an adult's dreams and their unconscious memories of what happened to them when they were infants? For this reason, psychodynamic theories have received much criticism from proponents of rigorous scientific research. Nonetheless, the psychodynamic model has contributed a great deal to the understanding of adult psychological abnormality. For example, it is because of the psychodynamic model that it is generally agreed that early childhood experiences and a child's relationships with primary caregivers have a profound impact upon their personality development and adult psychological functioning. Psychodynamic psychotherapy, with its focus on conversation and the development of a relationship between the therapist and the patient, continues to be a popular form of treatment for psychological disorders.